morning, everybody. I'm Jenny, one of the information and support workers here at Mummy Star. I'm delighted to be joined by our support team today, and we're pleased to welcome Dr. Lesley Harrison, who will be speaking with us today about health anxiety. Hello, Lesley.
Hello.
A very warm welcome. Thank you for joining us today. Would you be able to tell us a little bit about yourself?
I'm a clinical psychologist by background, worked in the NHS, worked at Coventry University, training up clinical psychologists, and now do a lot more of these kind of training sessions, as well as run my own clinical practice down here in sunny Stratford-upon-Avon.
We really appreciate you being with us today to answer some of our questions and for us to better understand health anxiety and how we can support our mental well-being. We know it's a really important topic, and it's one that we discuss really frequently with the women that we support here at Mummy Star. So it's really great for us to be able to have this session with you today. So we'll start with our first question, if that's okay. Many of the mums we support frequently share that they experience health-related anxiety after their diagnosis. The anxiety often stems from concerns about their own health, especially the possibility of their cancer recurring, as well as the well-being of their baby or their children and partner. Could you explain what health anxiety is and how it presents? What are the common thoughts and feelings associated with it? And what are the challenges with it?
Yeah, certainly. We're going to talk a little bit about anxiety in general and then move on to health anxiety. And I've just been talking to the ladies to say, I couldn't resist putting a bit of a presentation together. That doesn't mean that we don't go off piste and we can talk about anything that comes up. But I think it's helpful for when people look back at this on your website. So yeah, going back to your question, Jenny, of course, it's understandable that anybody diagnosed with cancer is likely to feel anxious, given what mum has gone through or a parent has gone through with regards to cancer and a diagnosis. There's a lot of adjustment, a lot of loss, a lot of pain. So it's so understandable that there will be levels of anxiety. But that said, that doesn't mean to say, oh, okay, that's normal, let's just crack on. Actually, we still need to be thinking about when does this level of anxiety become too much, and we need to think about support. So let's go on to think about what actually is health anxiety. It used to be called hypochondria. Nowadays, not so, because that's got such negative connotations all about, is that made up? It absolutely isn't. These are real sensations that someone's feeling. So it's now referred to as illness anxiety disorder or health anxiety. As I've already said, not irrational at all. This is following a real life event of a cancer diagnosis, and cancer may be ongoing. And it can often be rooted in trauma. So lots of trauma related to the adjustment of, crikey, where's this come from? What's this about? Medicine, having to go to appointments, hospitals, GPs, doctors, etc. So we'll talk more about trauma a little while. How do we diagnose it? Well, there has to be persistent fear, a fear and a worry about serious illness happening, and that's despite lots of medical investigations saying, no, it's okay, it's clear, or actually what you're worried about is not of concern at present. So I think we've got to juggle this, because I know a lot of your mums will have ongoing cancer, so there is something there, but it's when does the anxiety go above and beyond an impact on life. If we were talking general health anxiety, you'd have to be thinking about misinterpretation of some bodily sensations and how people then think that that's a more serious illness. Important to know that we're not just talking about physical illness, and people can really worry about developing a mental health illness like schizophrenia or dementia. Common behaviours can be kind of lots of checking of your body, lots of checking of the internet, lots of asking people, reassurance. And that's then what builds up to lead to the distress, and then sometimes avoidance of things. We'll go into that later. Does and can overlap with depression, obsessive compulsive disorder, generalized anxiety disorder and panic. It may not, but I always think of the mental health difficulties kind of really conjoint at times. So you can imagine if somebody gets really anxious over time, they can really feel low in mood, and that can lead to depression. But the big and the most important thing to think here is it's so highly treatable. There's so much support and intervention that can help. So really, people don't have to suffer in silence. Just a few common statistics. 6% of population will have it at some point, so you're not alone. It is quite common. But a person cannot just slip out of it. Yeah, so asking someone to just kind of, come on, you've been told 100 times that this isn't what's happening, you're fine, let's go. No, that's not possible. It needs support, and it needs help, and it needs compassion. It's nothing to be ashamed of. It's not your fault. Sometimes people will get really caught up in, how did this happen? What have I done? If I'd done this, would this not have developed? It's not your fault at all. And it takes time. And that's physical and emotional. Recovery takes time. So I think you were asking about some of the consequences and then moving on to challenges. A lot of your mums, all your mums, will have had cancer or diagnosis. So that in itself can trigger anxiety and health anxiety. So we don't even have to look any further afield. However, for other areas of the population as well, genes can play a small part. That's if a close member of the family had an anxiety disorder diagnosed. But bear in mind, there's the nature versus nurture question, because if you've grown up with somebody who was really quite anxious, then you might have picked up that anxiety. That's not necessarily about genes, that's about your environment. And of course, obviously, a trigger is the fear of my life ending or of losing control, because that's what anxiety is really about. It's that loss of control. I don't know what's next. It's unpredictable. So that fear is real. And then being told that anxiety is normal. We've said this already. The problem is the consequences. Mums might not go and actually seek help if we just say, yeah, it's understandable you're anxious. Actually, I think it's still important to keep check on this level of anxiety. Anxiety is normal. We all feel anxiety, but actually that continues and continues. It can really impact on life. We'll talk about that in a minute. Of course, if we don't acknowledge this anxiety, it can affect parenting as well. Not only yourselves and where you're at in life, but your relationships with your children, your partners, your friends. So there's a lot that can develop from feeling anxious. We will talk more about this, but emotional sensations, that fear, anxiety, dread about the future. And I think you also asked about what are those core feelings, sometimes that are not talked about, and that can be the guilt. The guilt about feeling like this when maybe a mum wants to get on and parent and be out there enjoying life. The guilt about, why am I feeling so anxious, so helpless? I can't do anything about this. And those two emotions can then lend themselves to feeling really, really lonely, really isolated, and then withdrawing from people, community, activities, etc., which creates a vicious cycle. So there's a lot of big emotional sensations going on there. And of course, that's tied in with this feeling a lack of control. And it's hard to tolerate that uncertainty, which again exacerbates the anxiety. Some of the thoughts that might come up for mums, what if the cancer comes back? That's if it has already had the intervention and gone. What about thinking every pain that I feel must mean something's wrong? So forever checking in case this comes back. What if I'm not here to see my children grow up? That ultimate fear, what happens next? If something happens to me, who'll take care of my baby, my children, my partner? And I'm thinking about the failure aspect. Sometimes moms in that guilt mode would like to be able to be all performing wonderful super mom and just can't at this point, not feeling good enough, not being able to do the things that they wanted to do. And maybe even then moving from the sadness to feeling quite angry. It wasn't meant to be like this. It's not there. I'm very mindful. I could be touching on some of the things that you might be thinking. So I'm just going to put a little bit of a caveat now to please just look after yourself as we're talking through this. You are in a safe place, and Mummy Star are here to look after you and talk to you. So if anything is being activated while we're talking about this, please get in touch with them. Some of the physical sensations that come with anxiety, headaches, fatigue, chest tightness, dizziness. I'll let you read the rest. So much. And I think often people think this is how anxiety might manifest. People don't always know, oh, I feel anxious. Actually, what they might feel is, oh, my tummy's rumbling again, or I'm having to dash to the toilet, and not realizing that that's actually anxiety manifesting itself. It doesn't always come up to awareness. It doesn't always come out in tears or rage. It can come out in the body. And then the kinds of behaviors that you might see someone doing if they're feeling highly anxious. Being really hypervigilant, looking out for lumps, bumps, anything on the body. Frequently going to doctors to check up to make sure things are all right, or actually maybe even avoiding doctors and hospitals. Don't want to hear what it's about. But of course, seeking reassurance. And there's that word, hypochondria, which is about basically Googling, trying to find these symptoms, and a lot of catastrophic thinking. I'm going to move on because I'm aware that Jenny's got more questions to ask me.
Thank you, Leslie. Sarah's going to actually ask our next question today.
Anxiety can be felt both physically and as worrying thoughts. These physical sensations can often exacerbate the worry an individual has about their physical health, which can then in turn create a vicious cycle. Could you explain what happens to the mind and body when experiencing anxiety?
We all feel anxiety about all kinds of things. It's the body's response to a perceived danger. And you've probably heard of fight, flight, freeze. And there's also another one called fawn. So essentially this little place in your brain called the amygdala that's just going, right, do I need to get going and fight? Do I need to get out of here because it's too scary? Am I paralyzed by fear and I'm just not going to move? You think about a little mouse when a cat comes along. Sometimes the little mouse will just stay put and hope that the cat runs off. And fawn is another one about kind of pleasing someone who might be harming you again in a way of just staying put. The response is triggered, though, even in the absence of real danger. So what's happened is we've got a very tricky brain. We've got the old brain that just fires straight out. Right, I've got to freeze or fight, whatever. And there's no cognitive enhancement to that. There's no thinking about it. So what's happened now is the new brain puts some thought onto this. So it might not be dangerous, but it feels alarming. And again, especially if you've been or you're going through cancer, it's real. It's not to say it's not real. It is real. But the body is responding in all these different ways. So you can see there, we've touched on a little bit. I just want to point out that all of those responses are so normal. The whole point of your racing heart is to get blood around to your muscles. The whole point of breathing is to make sure you've got more oxygen in case you need to get out of there. Sweating cools the body down. Stomach upset is because your digestion slows down while your body's in this preparation mode. So they're all very legitimate responses to anxiety. Now I'm just going to quickly show you a vicious cycle of anxiety. I just want to suggest an event. It's late at night and you hear a loud bang downstairs. What do you think? What's the immediate thought? So if you don't mind being a bit interactive with me, what might you immediately think if there's a loud bang downstairs?
A burglar.
Okay, you've got a burglar coming in. Yeah, if you do feel or you think, oh, this is an intruder, what goes on in your body? Are you all calm and chilled, or what does your body do?
Straight away, sort of the deep breath and then
Adrenaline pumping.
heart racing,
Start to get sweaty palms.
So they're all the anxiety responses. Very normal, very typical, just what we're talking about. If you're thinking, oh, it's a burglar, and your body's going around like this, how are you feeling?
Scared, frightened, worried.
Yeah. So that kind of fear, anxious response is going understandably like mad. And if you are feeling scared and your adrenaline is pumping, what are you going to do? Or not?
You think, oh, I'd get up and, I'd go and investigate, but actually you freeze, don't you?
Okay. So it might be that you're in the fight place and you go and investigate, or you might actually do nothing because you're scared. Yeah. Okay. Let's go back to that event, which is a loud bang. What else could it be? Is there anything else that it might be? That loud noise.
Well, my cat likes to knock things off, so probably my cat knocking something off the side.
Yeah, one of my teenagers deciding to make a snack or something and spill a drink.
Okay, so if we go down that route and you think, oh, cats knock something off, teenagers rumbling around the kitchen, what does your body do then? Is it heart rate increasing? Is anything particular happening?
Probably your heart rate would start to reduce.
Yeah, I think initially when you hear that noise, you would have a shot of adrenaline and your heart would pump. But then when you realise that it's the cat knocking something off or the teenagers, then your heartbeat slow down.
Okay, so you're not getting, so if you've gone down the route of thinking, oh, it's a cat or a teenager, your heart rate is fine. It's just as normal kind of thing. So it sounds like not a lot has changed then. In terms of your feelings, how are you feeling about the cat knocking something off or teenager making a snack?
Annoyed. But I certainly would be feeling scared or frightened or worried. I might feel worried thinking that he's broken something, but not in fear of my life.
Okay. Yeah. And if you're feeling annoyed or you kind of chill, do you do anything? Are you freezing in fear or are you getting out? Or
I want to have a look to see what it is. But if I'm really tired, I'll just go back to sleep.
Okay. So what you can see, I was trying to do with different colours. What's the difference between the red and the green? Any thoughts on what made the difference?
Interpretation in your head.
So it was all about this bit here, wasn't it? What did you start off with thinking? They all lead into one another. Essentially, the thoughts will connect to the body, will connect to the feelings, and then that's what impacts on what behavior you do. And then, of course, this just reinforces the thought. I'm going to freeze. I'm not going to go look. Therefore, I don't know whether it was the cat or an intruder. And they all interact, but it all came down to the fact, how did you actually interpret that event? Because it was the same event, but it was a different interpretation. And that different interpretation gave a whole different story. That's what we mean when we say a vicious cycle of anxiety. That's what we mean, that all these areas are all connected and then it just whirs and whirs and whirs. And you can see how anxiety itself then kicks on, going round and round and round. So when we look at health anxiety in particular, what actually starts all of this is the sensation, the body sensation. It's, oh, I can feel a pain. Oh, I can feel a lump. Oh, I can feel something in my stomach. That creates that arousal and that anxiety. And then there can be a misinterpretation of, this is dangerous. This means it's coming back. This means something's happening again. So that's a very simplistic view, but how health anxiety manifests in a vicious cycle. So you can see there that it's mapped out. There's the trigger, then the thought, the anxiety kicks in, and then that reinforces that belief there's something really not right. I'll start checking, I'll start seeking that assurance, or I might just avoid going to the doctors, and all of this starts to develop and go around in a big cycle. And then you'll get the cognitive, you'll get the head coming in. So I think that I said that this tricky brain of the old brain that would just go, right, come on, get out of here, fight, flight, freeze, fawn. But now we've got our new brain, which is all developed, which is basically saying, oh, I really need to think about this. Oh, what's the worst scenario? Better safe than sorry, should look after myself, etc. So that then becomes that hypervigilance and that awareness. And then what can happen is you can get these cognitive distortions sometimes, always misinterpreting these signs and symptoms, catastrophizing, and that worry about that intolerance of uncertainty. Bear in mind at the bottom, the shame sometimes of just not wanting to share this with anybody. Sometimes this can lead to low mood, depression, and even early experiences in your previous life, childhood, adolescence, etc., can all heighten this anxiety. In fact, sometimes, and maybe often, the origins of those initial body sensations are perfectly natural. It's just homeostasis. It's just your body trying to get that balance. So any kind of change in diet, if you've eaten too much junk food or had too much fibre or slept too long or not slept enough, all of that can affect your body. And then you will feel sensations and changes. And essentially, it's the sympathetic nervous system that's getting aroused and then will cause heart rate increases or gastro problems. So actually, they might be really quite innocuous, but they're getting interpreted as dangerous. The important part of just sharing this cycle with you is that if we can understand, it's not your fault, it's just we've all got tricky brains and our brains are primed to want to work out what's going on. But then that's what can lead to this vicious circle going on. But if we can acknowledge we're not being irrational, but we want to try and break this cycle. So awareness is that first step. So over to you guys. I think you're going to ask me another question.
Yeah, Frankie, please. Thank you.
So we recognise that the mums we support will naturally experience some level of health-related anxiety due to the challenges they face with their diagnosis. With ongoing scanners and monitoring, feeling apprehensive before receiving results is completely normal. Could you please discuss the difference between experiencing a normal or emotionally healthy level of worry and a more serious or concerning level of worry? What are the things to look out for that might mean someone could benefit from some professional support with it?
Yeah. Good question, because we've talked about how anxiety is normal anyway, but when do you know when it's just a bit too much? So if we look at, in inverted commas, because there's not necessarily normal anxiety, but it is natural. It would be completely natural to feel nervous about going to appointments or scans and anxious about what the outcome is. But often this can subside with a little reassurance and it can be temporary. If a person is able to talk about their worries and get on in life, so they're still able to get up and do things, that's all part of healthy, usual anxiety. It's part of adjusting to a diagnosis. But when does it become more serious? And essentially, only the person themselves can often know this for sure, because it can be internal and external as to what you can see. So internally, a person could be really having really intrusive, persistent thoughts, no matter what they're doing during the day. It's coming at them all the time. The what ifs. And that means externally, somebody might see someone seeking lots and lots of reassurance from different people. And that might be different doctors, different family, different friends. A person might have images and memories that they're replaying over and over and quite traumatically so. And again, that rumination just going over and over and attending to kind of what's happening in the body. The thoughts get fused with the past experiences. So it's like, that's all I can think about, these past experiences. In terms of emotional distress, then if a person is starting to feel completely overwhelmed, a feeling of hopelessness, feeling numb, irritable. So lots of emotions again, natural emotions, but when this feels so much so that a person is starting to avoid things like avoiding hospital appointments, avoiding talking about things, talking about their worries, avoiding socializing, and again, doing so much more of that reassurance seeking, or even just keeping themselves to themselves, don't want to talk to anybody. What other people might see looking in, they might see that sleep has changed, or person's not eating so much, or they're eating more than usual. Person might not be able to concentrate, manage routines. They might not be interested in things that they used to be interested in. And that worry is persisting. Even if they've got the results back that say, it's okay, the cancer's at bay, it's done, it's over, it's gone. Any of that, the worry just keeps going. When you ask the question of when to seek professional support, always, when mood has gotten so low that a person's starting to have thoughts of ending life. Now, that is quite common. You'd be surprised at how common thoughts of ending life are. And that might not be, I want to end my life. That might just be, oh, I wish this was all over. But when you're starting to have thoughts like that, it's important to talk to somebody. It's really important to not be on your own and have to keep managing all of those ideas going through your mind, because you can see the next part is saying, of course, it affects how you are within the family, within your friendships, your relationships, or at work. So when it's affecting life as you know it, that's the time to seek professional support. So there's not really a lovely cut-off. We have got questionnaires. So if you go to your GP and things have been continuing to be really problematic for at least a couple of weeks, then they will start looking at what support to get you next. But these are the things that if you can look in on yourself, or sometimes family can look in and see that some of this is happening, that's the time to reach out. People like metaphors, and I've included a YouTube link there. I think you've got an Ask the Expert on ACT, acceptance and commitment therapy. So that's worth a look. And one of the lovely metaphors that they use in ACT is about the unwanted party guest. So it's essentially thinking about anxiety as kind of an unwelcome guest at a party. So the idea is you're hosting a party and this neighbour who you don't really like gate crashes it and keeps coming in. And you keep throwing this party guest out saying, no, I'm sorry, you weren't invited. Essentially, that's all the intrusive thoughts, etc. and the anxiety that's coming into your mind all the time. And this unwelcome guest keeps coming back, but you end up standing at the door, blocking the guest. That's it. Sorted it. The guest can't come in anymore, i.e. the thoughts can't intrude anymore. But the problem is the party's going on and you're not part of it. You're not enjoying your party because you're busy stood at the door blocking these guests coming in. And the part there is trying to say that you're not enjoying life, you're not engaged in life because you're so busy trying to block or work out and manage this anxiety. So the idea is somehow to mindfully let this guest come in, and then that diffuses the power that this guest has. And you can talk more about that if you choose to go down and seek professional help. But sometimes people like this idea of a metaphor to say it's not your fault.
Thanks, Lesley. I'm just wondering if somebody recognises themselves in this scenario, what are the first steps that they could take to seek professional help? Who would they contact in the first instance? And what types of support and therapies are available? And what role does medication also play in this treatment?
So it's a great question, because by asking that, it's going back to what I said earlier. Health anxiety is highly treatable. I would hate that anybody ever feels alone struggling with this, because there's a lot of help out there. So where to go first? GP is always first and foremost if you can. I appreciate sometimes people don't want to go to their GP, so we'll tell you more about places that you could refer yourself. Obviously, Mummy's Star, you can have a confidential conversation there, and they're a mine of information to be able to signpost you to anywhere that you might need to go. But they're your health professionals. So that might be the GP, the cancer nurse specialist, or your oncology team, your health visitor. Bear in mind, it is important if you feel lumps and bumps and you're really worried, go and get this checked out. Nobody's saying that this is all about anxiety, but this needs to be checked out first. And then once you've had those investigations and they know that there's not a physical cause, then we can be thinking about more of the mind-body interaction, if you like. But as you know, your oncology teams are specialists in this area, and there's often a psychologist sitting within oncology teams. So again, somebody who's trained to be talking through this as I am. I think sometimes I do this myself. If you're feeling really anxious, you don't even know how to say it or what to say. So just some ideas of being able to name. You might be able to go to someone, I'm feeling really anxious about my health lately, even when I know things are okay. My worry about recurrence or symptoms is affecting my sleep, my ability to enjoy life. I think I need some support for how I'm coping emotionally after my diagnosis. And they're all basically trying to signal that it's more than a bit of stress. People will understand and think, of course, if you've got a little one or children, of course there'll be stress, but this is more than parenting stress. So it's important to get that care and attention for your mental health. In terms of the psychological support, there is counselling, which is much more about sitting down and talking through. There's no kind of real fixed agenda. This is about talking through where you are right now, what's going on for you. And sometimes that's exactly and all that is needed, to talk with somebody a little bit impartial, not family, not friends, not anybody telling you how you might manage this or what you might do to feel better. There's cognitive behavioural therapy, or CBT, and that was a little bit of what I touched on earlier when I did that cycle of thoughts, feelings, body and behaviour. It's got a lot of good evidence, 19 randomised control trials that were looked at 1999, I think, to 2019. They've noticed that health anxiety is significantly reduced. So it's got a lot of evidence for this. However, I also know that some people, they don't click with CBT. And I think actually what's needed is a lot more of the compassion focused therapy. So that's really for people to just start thinking about being kind to themselves. It's very helpful with people that are really stuck with feeling guilty or shame, because no matter how friends and family might say, oh, you've nothing to feel guilty about, it can block people really talking about what's going on for them. As I alluded to earlier, it would be unsurprising if people weren't traumatized by some of the experiences that they've gone through. And so trauma-informed therapy can really help with that, as can EMDR. EMDR is eye movement and desensitization and reprocessing. And I won't go too much into depth. You can explore that, but I have put a link onto a really great book that's helpful. But it's a wonderful therapy that can help with trauma, particularly if there are images or memories that are just replaying all the time in your mind. And then group therapy or peer support. I'd never underestimate how helpful it is to talk to someone else who might have gone through something very similar, because they are probably the closest that get it. As much as your family or friends are helpful and supportive, they may not have gone through the exact experience you have. So group therapy or peer support really helpful. And finally, as I say, you've already got an Ask the Expert webinar on ACT, which is acceptance and commitment therapy. And so have a little look at that. But that is really helpful for thinking about your goals and moving forward. You asked about medication. So I'm a psychologist, not a psychiatrist. It'll be the psychiatrist that would talk to you as well as the GP about medication. But I do know that with anxiety, it's the SSRIs that are often used to help anxiety and depression. It's not typically recommended, or a GP doesn't necessarily prescribe it for mild to moderate symptoms. But if those symptoms are ongoing, then they will prescribe it. There's a lot of good evidence for a low level of medication and cognitive behavioural therapy. To do both is supposed to be really helpful, and it's really helpful for moderate to severe health anxiety. The way I often say and discuss this with clients is to say, sometimes when we're so anxious, as I described the symptoms earlier, our mind and everything is just all over. You can't settle, you can't think straight. So actually a small amount of medication just settles your mind so that then you can actually start learning some of the things that will help you, some of the skills or some of the interventions, the toolkit, and then eventually you can reduce that medication and you're left with this toolkit that you've got for life, really, being able to manage your anxiety if it flares up again. So yeah, medication can be helpful, but I would always recommend combined with a psychological intervention so that it's not just all about medication. But again, people like analogies. Sometimes it helps embed things. If you think about this as kind of, you've got this great big garden of life, and the anxiety behaviors that are coming through are like little weeds that just keep coming up, and they're springing up all over the place. Sometimes a little bit of that medication is a bit of weed killer, but it might be that those little weeds start coming up again. So the important thing is to get some of these positive habits that you'll learn through psychological therapy and then start planting new flowers to replace and move out those weeds. So the idea, it says in the last box, is to maintain the garden. And that's kind of reducing all the checking behaviors, actually having a more fulfilled life. So in summary, think about who you can talk and connect with, i.e. Mummy's Star, and then the health professionals. Consider whether medication might be right for you. So important to connect. We are social beings, so connecting with people and talking about your fears is important. Consider joining a peer support group. And then I think we're going to move more onto this, but really, really practice some self-compassion for yourself.
So our final question today. Over time, whether individuals have sought professional support or not, health-related anxiety can gradually ease and become less intense or less frequent. But could you share some insights on some gentle and practical approaches and what we can use to support our mental well-being, along with ways to build the toolkit that you just mentioned there, so that on challenging days, moments, or life events that throw us into feeling a little bit more anxious than normal?
Absolutely. And this is where there's so much, so hence why it's probably good to have this written down. Different things, so different people. Different things, so different people at different times. So like we've mentioned, a toolkit is trying to pick out what might work. So I'm just going to throw lots of things out there, and we will come back to this at a later date. People will talk a lot about grounding, because when our minds are busy worrying and ruminating, we're not really here in the present. We're off. We're worrying about the future, or we're thinking about the past. So there's something about trying to get us back into the present. I don't know if you know all about some of these techniques, the 5-4-3-2-1 technique. The idea there, as it says, is to look around you and name 5 things that you can see. Then think about and name 4 things that you can feel, that you can touch. Then 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. Sometimes taste is the hardest one to get hold of. The idea there is that you're tapping into all of those senses. And even if it takes a few seconds to do all of that, you've come away from your ruminations, etc. Similarly, touching something comforting. So really snuggling up with a blanket or a warm cup of tea. Or I've got a lovely kind of rock that I hold on to sometimes when I'm just musing on things. Connecting with nature, turning your phone off, taking a walk, smell the flowers, just getting outside, connecting with others. And then some of those kind of mind-body interactions of just calming your body. And again, I won't go into the biology of it. There's not enough time. But if you can kind of trick yourself by slowing your breathing down, that kind of tricks your brain to say, oh, things are okay. So when we say balloon tummy, that means use your tummy to breathe from. Because when we're anxious, we breathe from our chest. So think about when you're breathing, it's as if there's a balloon in your tummy that you're trying to inflate, and then it deflates. There's deep breathing, where you inhale for 4 seconds, hold for 4, and exhale for 6. Just always thinking about breathing out longer than you breathe in. box square breathing, where you imagine you're kind of going around a box, if you like. Inhale for 4, hold for 4, exhale for 4 seconds, fold for 4 seconds. Mindfulness, meditation. One of the ones I love is Insight Timer. It's all free, and there's all kinds of, whether you like strictly music or waterfalls, or whether you like someone talking to you, guided meditation. And I won't go too far into the diving reflex, because this is probably when you're really quite highly anxious, but you can read up on that a little bit more. So the idea is having a bit of a toolkit to hand all day, every day, little bag that you carry that's got some of these items in it. I've already shared about the importance, I can't emphasize this enough, just being kind to yourself. Just taking a moment of thinking you can't always control where your thoughts go. This isn't your fault. So trying to reduce that self-criticism and saying things like, it's a hard moment. I'm allowed to feel like this. And then maybe thinking, what would you say to a friend? And trying to say that back to yourself, because we're really not as kind to ourselves as we are to other people. And again, I'm sure that the gentleman who did the ACT, Ask the Expert, the Mummy's Star, would have talked about this, the idea of labeling the thoughts. It's bigger and needs more than the 2 minutes that we've got left, but the concept is they are thoughts. It's not an actual fact. So sometimes if you insert I'm having the thought that life is really scary and I don't know where it's coming from, you can label that as an actual thought rather than, I don't know what's happening in life. So there's something about trying to give the distance. ACT will talk about if you have thoughts and they're overwhelming and over your face, you just can't see any other perspective. So in actual fact, trying to get a little distance from your thoughts can be really, really helpful. I won't go into this now, but there is a lovely acronym called STOP. Stop, take a breath, observe around you, pull back and get some perspective, and then practice what works. But you can come back to this or look this up. Keeping a journal. A lot of people find that really, really helpful. So when your mind is going off on one, just basically write in. Don't stop, don't punctuate, don't worry about how it looks, just write. And sometimes that releases those spirals of worry. Alternatively, you could write yourself a letter on a good day, how well you've been doing. You could include letters of encouragement from friends or family, gratitude list, and maybe list all those things that helped you feel better. So essentially, just as Jenny was saying there, you're trying to create a tough day toolkit, something that will be comforting for you, something that's worked for you, because it's different for everybody. And even if it's just putting on a pair of fresh socks, that's what works for you that day. Lean on connection. Make sure you connect with others. Ask for help if you can. For something small, try not to do this alone. I'm thinking about joining a support cycle. And create some routines, because routine can help. So it might be getting up and thinking, what do I need this morning? What will help me? What will help me get through the day? So last but not least, just bringing that together in a supportive toolkit. Thinking what will help you. This will look different for every single one of us. So it's really taking some time to think about what will work for you.